Hi, I'm Nikki Bell, and I'm going to show you how to check your horse's vital signs. So when you first see your horse coming in from the pasture or in a stall, you want to check his general appearance, making sure he's alert, happy, or whatever his normal appearance is for you. His coat should be nice and shiny. You don't want it to be dull. You don't want him to look dull or listless. You want him to have a nice bright eye, nice alert face, and you want him to generally look like he always looks. If something's different, something's completely off, that might be a solid indication something's wrong. First vital sign you're going to check is his temperature. You're going to take your digital thermometer and you're going to lubricate it in Vaseline. Put your Vaseline down. Make sure it's nice and lubricated. Turn your thermometer on. Make sure it's on Fahrenheit. You're going to lift up your horse's tail gently, move it away from his rectum, and gently insert the thermometer into his rectum and pushing up against the rectal wall so that you get an accurate reading, and wait for it to beep at you. And once it beeps at you, his reading is 98.7. That's actually low. A normal reading should be 99.5 to 101.5. But given the circumstances, it's about 20 degrees outside. He's not wearing a blanket, and he's just standing in a stall. That is a seeming okay temperature for him. The sign you're going to check is his respiration rate. To check the respiration rate, you're going to watch his flank rise and fall for 15 seconds. Each rise and fall is one beat, is one breath. So you're gonna stand up next to his shoulder and face his flank and watch it rise and fall, and have your stopwatch ready. So for 15 seconds, I only counted 2. And 2 times 4 is actually only 6. That is a little bit low for him. Then normal respiration rate should be between 8 and 16 or 10 to 20 breaths per minute. Another sign you're going to check is their gut sounds. You're going to check high gut sounds, low gut sounds on each of the 4 quadrants, one on either upper and lower on either side of his flanks. To do this, you're going to lay your ear facing forward, lay your ear up against his upper flank and his lower flank. And he has some good, nice gurgling sounds. What you want to hear nice, quiet, but not too quiet gurgling sounds. If you hear a rushing or a pinging, that can be an indication of some sort of gas colic or impaction or any other type of colic. You also want to make sure that if you don't hear anything, that can also be a problem. It can also be an indication of something stuck or impacted in his intestine or somewhere else in his gut. The next vital sign we're going to check is his pulse. To check the pulse, you can check it in one of 2 places. You can check it under the jaw by laying your 2 fingers up against the external maxillary artery. Once you can feel the pulsations under your fingers, you're going to set your stopwatch for 15 seconds. And I counted 7 beats in 15 seconds. You're going to multiply that by 4, and 7 times 4 is 28. That's actually slow. The normal is 32 to 44 beats per minute. Given the circumstances, he is just standing here resting. He is a normally low-rated horse, so I would actually consider that okay for him personally, but it does depend on your specific horse. You can also check the radial pulse if you cannot find the pulse under his jaw. You're going to find it down here behind his knee. Thank you. And if you're going to find a digital pulse, that actually indicates there's something wrong. When you see a digital pulse, you're going to find it on the back of their fetlock. If you can actually feel your digital pulse, that means there's something going on wrong in his leg or in his foot. And that is a circumstance where you're going to call your vet right away so that they can help you find out what's wrong. Next, we're going to find his heart rate. To find the heart rate, you're going to look behind the elbow against the chest wall. You're going to use your stethoscope and your stopwatch. And once you have your stethoscope on, you're going to put it up against the chest wall and listen for his heart rate. And you're going to do this for 15 seconds, and in 15 seconds I counted 7, and you're doing 7 times 4, which is actually, again, 28, so it matches his pulse rate. And for him, again, it's low, but that's normal for him, so I would consider that okay. Average is still 32 to 44 beats per minute. Next, you're going to check your horse's skin pinch. This is a check for hydration levels. Depending on the age of your horse, his skin pliability and elasticity may not be as strong, so his skin may be tinted for a little bit longer. But for a young horse like Luke here, his should come down. His skin should tint and untint in about 1 to 2 seconds. So you're going to pinch his skin, lift it, 1, 2, his skin goes back down to normal. So he is nice and hydrated. Another way you can check hydration is in the mucous membranes, doing capillary refill. So his mucous membranes can be found in his gums or under his eyelid. To check your mucous membranes, you're gonna lift up his lips. They should be a nice moist light pink, and his are nice light moist and pink. You're gonna press your thumb up against the skin, up against the gums, and then release it, and it should return back in 1 to 2 seconds. And his returns in 1 to 2 seconds. If your mucous membranes are white, they can indicate anemia or blood loss. If it's bright red, it could indicate an infection, or if they're blue, they could indicate lack of oxygen, and if it's yellow, it can indicate some sort of jaundice. And those are all problems, and you should definitely call your vet as soon as possible. This is how you check your vitals. I hope you learned from this video. Thank you.